Okay, so let's talk about cardiac catheterization. Okay, very important point. Cardiac catheterization, angiography. Okay, so looking inside the heart through the blood vessels. That means we are going to look into the heart, but we are going to go through the blood vessels. We are going to go to the heart via blood vessels. Okay, and how is that possible? So we are going to insert the catheter. Through the catheter, we are going to go in and we are going to check the blood vessels whether there is any blockage or not. We have already inserted the dye and you can see the live picture when you are inserting your catheter. So in the cath lab, if you might have worked, it's a live monitor. Through that you can see where your catheter is moving, what artery you are in, and blockage and everything. You can get the information by this cardiac catheterization. This is the main important procedure, very important procedure. So use your favorite marker to underline, and we are going to remember pre-procedure, during the procedure, and post-procedure interventions. And after that, whatever procedure we talked about, they are starting with the cardiac catheterization. So we must need to know about this, and other procedure will follow. Okay, so purpose. What is the purpose? We want to examine if there is any blockage in the artery or not. We want to check if there is any blockage in the coronary artery. We want to check, we want to measure the pressures in the heart chambers. If you want to check the pressure in the heart chambers, you can also perform cardiac catheterization. You can also check the valvular function by cardiac catheterization. Now, valvular function we check through echocardiogram. That was non-invasive, but this is an invasive procedure. Okay, can also be used for interventions, meaning this is right now we are talking about the diagnosis, right? We want to know whether there is any blockage or not. But let's say you went in and you found out that there is a blockage. You just don't want to come out simply, but you want to treat that right there. तो हम यहाँ पे अंदर गए and there is possibility to treat it. So हम वहीं पे stent भी रख सकते हैं. We can also perform plasty, like we can inflate the balloon and we can dilate the artery. We can perform atherectomy. We can remove these, all plaque. We can try to remove that too. वो सारे interventions after cardiac catheterization we can do. Okay, so it's not only diagnosis purpose, but we can also perform it for the treatment. Okay, guys, can you hear me? All of you? Yes or no? Okay, no answer, that's fine. So pre-procedure, what is the pre-procedure? So in the pre-procedure we are going to keep patient NPO. We are going to insert the dye. So we are going to check the patient for dye allergy, whether you have any allergy to any seafood, iodine, whether you have allergy to any shellfish or seafood or iodine. And we can tell to the patient about the symptoms that patient is going to experience, like flushed feeling, metallic taste in the mouth. Okay, so that we can inform. We can also check the patient's kidney function, BUN, creatinine. Why? Because if the kidney is damaged or the BUN or creatinine is elevated, we don't want to insert the dye, because dye is going to harm the kidney more, right? And patient is not able to excrete this dye out of the body, will remain in contact with the kidney for a long period of time, and so causes more damage. So it's very important that we check the kidney function. Obtain informed consent, mark the peripheral pulses, and ensure the IV access, and may hold metformin, because anti-diabetic drugs we don't want patient to take when we are going to inject the dye, because that causes lactic acidosis. Okay. During the procedure, patient will be awake, but patient is going to be still, and we are going to ask the patient to change the position. According to the doctor's orders, they will be changing the position, but most of the time patient is going to be still. So we have to inform to the patient about it. Patient is going to feel warm, which is flushed feeling when you inject the dye, and you are going to check the patient blood pressure, EKG, when you are injecting the dye. Once the procedure is done, post-procedure, what is important for you? Encourage patient to drink lots of fluid. The fluid is very important. So patient is going to be flat on the bed for 4 to 6 hours, and we have to check for the bleeding and hematoma. Now this is very important point. As you have chosen this side, you are going to check the pulse here and you are going to keep the extremity like this. But if you have chosen femoral side, very important, you are going to keep the patient flat, extremity will be extended. Why? Because if the patient flex the extremity, what is the risk? The risk is of hematoma. And when there is hematoma formation, patient is not going to have enough perfusion to the extremity and the pulse will be decreased or weak or thready. So peripheral pulse check is important and also keeping the extremity extended. तो हमने पहले भी डिस्कस किया है कि when patient's femoral artery is used, so you have to keep the patient flat in the bed, that means extremity will be extended. Now anytime if the patient is getting up to eat meal, तो हम उसको 15 to 30 डिग्री से ज़्यादा एलिवेट नहीं कर सकते. We cannot elevate the patients more than 15 to 30 degree. The reason behind, what will happen? There is a flexion in the groin area. If there is a flexion, so what will happen? Hematoma. So we don't want that. So patient is going to have extended extremity. This is very important point. Now bleeding hematoma के लिए check करेंगे. Peripheral pulse we have to check because before the procedure what was the pulse of the patient and after the procedure what is the pulse of the patient, that we want to check. Vital signs we are going to check. EKG, urine output is very important. Why urine output is very important? Because we injected dye and we want this patient to excrete all the dye out of the body. So this is important. Okay. Keep extremity straight, avoid any movement and encourage fluid to flush the dye out of the body. Very, very, very important. Very important procedure. Okay. So before procedure, during and after. Same like dye precautions, that we take, that we have to take in pre-procedure, inform concern, diabetic medication, kidney function, check the peripheral pulses. During the procedure, metallic taste, flushing, have to be still during the procedure. And after procedure, flushing out the dye is important, checking kidney function is important, keeping extremity extended is important, keeping the patient flat in the bed, okay, and encouraging fluid is important. Are there any complications from this procedure? Yes, there are some. So bleeding and hematoma, as we already talked about, there is a hemorrhage, infection can occur. Now when you are going in through catheter or through blood vessels, via blood vessels through catheter, possibly you may cause dysrhythmia. So monitoring is very important. And sometimes patient may develop allergic reaction that patient never had before, but this is the first time that we perform this kind of procedure and patient is developing allergic reaction because of the dye. So that is another thing. Let's say you did not check the kidney function, you injected the dye. What is possibility? Kidney damage can occur. So these are the complications that you have to monitor the patient for. Okay. Okay. Now this is another diagnostic test, intravascular ultrasonography or ultrasound. So it's the same thing like cardiac catheterization. We have to insert the catheter, but catheter will have the transducer. Transducer जो हम ultrasound में बाहर से कैसे big size का होता है, we put the jelly on that and then we move around over the area and we can examine what's going on in that particular organ, right, or the area. Now here you want to know what's going on in the artery, the blood vessels. So you are going to insert the catheter. This has a transducer that's going to take a picture. So real time you can have information what's happening into the blood vessels. Okay. So it is alternative to injecting dye. That means someone who has very bad kidney function, BUN is elevated, creatinine is elevated, but we have to perform something. We have to check what is going on in the blood vessels. But without dye, it's not possible. But this is the test. If patient is not able to tolerate the dye, we can insert the catheter. But this catheter will have transducer, so we don't have to require to inject the dye. Without injecting dye, we can take the picture through this ultrasound. So this is intravascular ultrasound. Okay, this is how you can get the real picture when you are going in. You can have some idea about the blood vessels. Okay, so the procedure that we did here, cardiac catheterization. So as I said, you cannot just go and see and come back. So we want to perform some procedure. We want to treat this, right? So हम यहाँ पे आए and we found out that there is a narrowing of the artery. Okay, narrowing of the artery. Not because of the atherosclerotic plaque, it's just that there is a narrowing of the artery. Now you want to dilate that artery. So how you are going to do that? So the same cardiac catheterization you are going to perform, but you are going to go in and you are going to inflate the balloon. Okay, and after that you can also put the stent, because what happens is, let's say you are inflating the balloon, you are dilating the artery. After a few months, patient will come back again. And when you examine the patient, when you perform this, scan and everything, again this artery is narrowed down. Again you are inflating with the balloon. Patient goes home, again he is coming back. So we don't want this in and out of procedure, right? So what we want to do is, once you inflate the artery with the balloon, once you dilate the artery with inflated balloon, you also want to place the stent in. So once you place the stent in, what will happen? The artery will remain open. फिर वो नैरो डाउन होने के लिए चांसेस नहीं है. ओके, तो वो भी हम कर सकते हैं. दैट प्रोसीजर इज कॉल्ड परक्यूटेनियस ट्रांसल्यूमिनल कोरोनरी एंजियोप्लास्टी, PTCA, और समटाइम्स यू कैन आल्सो यूज द वर्ड जस्ट एंजियोप्लास्टी, नॉट एंजियोग्राफी. ग्राफी में हमने डाई इंजेक्ट किया and we either took the scan or either the cardiac catheterization. Through catheter we examine the area. Okay, so that is angiography. Right now we are talking about plasty, angioplasty. So angioplasty में what are we going to do? So this kind of atherosclerotic plaque formation is there. Okay, so now we are going to go in via cardiac catheterization procedure. So whatever step we took there, like pre-procedure step, during the procedure, same thing we are going to do. You are going to go in, and once you are in the place, you are going to inflate that balloon. So you are going to dilate the artery, and with that dilation you are also going to place the stent in. So you can see here, this is a stent. Now this kind of stent, there are some also advanced, because of the advanced technology, some type of stent will be drug eluting stent, meaning over the time this stent itself will be releasing some of the medications to prevent the plaque formation further. Okay, so just for your idea. And sometimes it's just the traditional type of stent that we can place in, but there is one important point here that you need to remember. Okay, let's understand this. When patient has this stent in, what can happen is कि over the time when the blood is passing through this area, platelet counts, platelets, those are the cells that can get collected here. Okay, they can try to get deposit on the metals, and they can get clumped together, and over the time they can block the stent. Now if there is already stent in, and because of this platelet aggregation, if this stent get blocked, then there will be a problem, right? So there is very important point कि any patient who has this stent placed in, they are given antiplatelet medication for their whole life, which is aspirin or either clopidogrel. Okay, aspirin medication is the best that we can give to the patient to take that for whole life, because we don't want this stent to get blocked because of platelet aggregation. Platelet counts, we don't want that to get clumped together at the area of the stent. We want them to flow easily. So antiplatelet medication is the must medication to give to the patient. ये याद रखना है, ठीक है? We had one patient, I don't know whether I told you this story or not, but patient went for the coronary stent. No, not coronary, sorry. Carotid stent, because one of the carotid artery was blocked because of the atherosclerotic plaque formation. One was 60% blocked, the other one was completely blocked. So they decided to fix it. They placed the stent. Okay, stent. I think at that time it was 70 or 75% blocked. So they decided to put the stent in. So patient underwent the procedure. Patient was completely fine. Patient was given aspirin, but there was no communication that you have to take this medication for your whole life. Patient was given 1 month supply. Patient went to the primary care provider, and the patient already had that supply, and there was never a discussion about taking lifelong medication. As soon as patient was done with the medication, she stopped, and that stent got completely blocked in 1 month. And now they cannot remove the stent or they cannot fix it. So she has the stent, but the artery is completely blocked. We don't want to do this. This is a big mistake, and how that happened we don't know, but should never be the case. So please remember, whenever there is stent, you need antiplatelet medication. Okay, ये याद रखना है. ठीक है. So what is PTC? It's a non-surgical interventional procedure used to open the narrowed or blocked coronary arteries. either वो narrow हो गई है, either वो block हो चुकी है. Performed during the cardiac catheterization. So you have to follow all the steps of cardiac catheterization by inserting the balloon tipped catheter. So this catheter that we inserted has balloon at the tip of the catheter, and that balloon is going to be inflated to compress the plaque. So when, see, you can see here how much plaque is here, right? But when they inflated the balloon, they compressed the plaque, so they moved it aside and opened up the way for the blood. So, and restore the blood flow to the heart, and often combined with the stent placement, a small mesh tube inserted after the angioplasty to keep the artery open, or there is a drug-eluting stent that may release the medication to prevent re-narrowing. दूसरी बार narrow ना हो जाए उसके लिए from this stent some medications will be released. Okay. Now what do you think? For what kind of patients we want to perform this procedure? Coronary artery disease, right? When there is narrowing of the artery, when there is too much, atherosclerotic plaque formation, for those patients we want to perform this. If the patient has myocardial infarction, heart attack आया, heart attack के बाद भी realize हो कि one of the artery was 100% blocked, another artery was 80% blocked, so we want to fix those problems, right? So the artery which is 80% blocked, we want to go in, we want to inflate the balloon, we want to place the stent, depending upon this. There are so many other factors, but 100% block है तो उसको भी हम fix कर सकते हैं by stent. So angioplasty is very important procedure. So there are so many other indications. Some of the patients who are not a candidate for CABG, cabbage, so then we can perform a stent plasty. Inserted via femoral or radial artery, advance the catheter into coronary artery, balloon is going to be inflated and stent is going to be placed. Okay, important. Now pre-procedure, same like cardiac catheterization, patient is going to be NPO, patient, we are going to take informed consent, we are going to ask the patient about the allergies, we are going to ask the patient about any diabetic medications, IV line, peripheral pulse check we are going to do, and after the procedure, we are going to ask the patient to drink plenty of fluids, we are going to check the pulse, we are going to keep the extremity straight and extended, we don't want them to get flexed because hematoma formation का risk है. After the procedure, if patient has chest pain, discomfort, dysrhythmia, तो you are going to monitor the patient. ठीक है? And I already explained to you, this is very important. I want you to underline in your note कि antiplatelet medications are very important. That patient is going to be taking for his whole life. And other than aspirin, clopidogrel is the medication which is antiplatelet group of medication that we can give to the patient. Heparin भी हम दे सकते हैं during the procedure, and nitroglycerin. Now very important thing here, as we have talked this multiple times in endoscopy, colonoscopy, whenever you are inserting any scope into your body, there is a natural response of muscle spasm. We talked about this in laryngoscopy as well, bronchoscopy. When you go in, when you insert the scope, there is a possibility that the muscle spasm can occur. It's a natural response. So what if you are inserting one catheter here in the blood vessels which has balloon, you are inserting in, there is already atherosclerotic plaque formation here in this area, and possibly if there is vasospasm occur, तो आप तो completely block कर दिया ना, क्योंकि there is a space occupied by catheter, there is already there narrowing because of the atherosclerotic plaque formation, and with these two, if there is artery spasm occur or vasospasm occur, what will happen? You are going to block the artery. So in some of the patient, we also require to give some dilators, vasodilators during the time of the procedure. We need that because we want to prevent this vasospasm. Okay, and sometimes when you are going in, okay, you are trying to inflate the balloon. But with that inflation of balloon, you may rupture the artery. Bleeding होने के लिए chances है. Hematoma formation के लिए chances है. The most important complication is when you are trying to inflate the balloon, when you are trying to compress this atherosclerotic plaques, sometime possibly this plaque can get detached from the wall and can move into the circulation. आगे जाएगा तो फिर क्या होने के लिए चांसेस है? एम्बोलाई. एम्बोलाई इज द रिस्क. Okay, so these are the problems that may occur. Reocclusion, वापस से ब्लॉक हो जाने के लिए चांसेस है. ब्लीडिंग, हेमेटोमा, coronary artery dissection. Dissection माने रप्चर हो गया possibly. So these are the complications that we have to monitor after plasty. So angioplasty कोई बोले तो it's the same like cardiac catheterization, but we are going to fix the problem. How we are going to fix the problem? So we are going to inflate the balloon and we are going to dilate the blood vessels. Okay, so this is how we are going to inflate the balloon, dilate the blood vessels. We can also place the stent, which is plasty, stent placement, and then we are going to ask the patient to take antiplatelet medication, which is either aspirin or either clopidogrel. Very important. And you have to monitor for the complications. Sometimes you may rupture the artery, sometimes patient can have internal bleeding, hematoma. तो वो सब complications के लिए हम देखेंगे, monitor करेंगे. थोड़ा ध्यान रखो तो अच्छा है, rather than talking to other people. आपकी नोट में एवरीथिंग इज देयर इन योर नोट, बट जब इम्प्लीमेंटेशन आएगा ना, देन यू विल रियलाइज कि क्लास को सुना नहीं अच्छे से. प्लीज फोकस. Okay, next is laser assisted angioplasty. Angioplasty, but it is laser assisted. Okay, what are we going to do? We are going to go in same procedure like cardiac catheterization. You are going to go in, but you are going to use some laser waves. Okay, and this laser waves has capacity to produce heat, and with that heat what happens is you are going to break down this all atherosclerotic plaque, and this is how you are going to open up the artery or the blood vessels. So basically you are using the laser light, okay, and you are going to clear the way. So you can see here from the back side the plaque is gone, or maybe you are removing it. Okay, so using the light to clear the path. आप ये याद रख सकते हैं, using the light to clear the path. So that is laser angioplasty as a specialized form of percutaneous coronary interventions where a laser tipped catheter is used to vaporize or break down the plaques inside the narrow coronary arteries. Okay, so how does it work? So catheter with the laser fiber is going to insert it and it's going to produce lots of heat, pulse ultraviolet light, and with that light it's also going to vaporize these cholesterols. Okay, so that does help. किस में हम यूज कर सकते हैं? तो सेम इंडिकेशंस, कोरोनरी आर्टरी डिजीज, देयर इज आर्टरी स्टेनोसिस, लॉट्स ऑफ कैल्सिफिकेशन, उसमें हम यूज कर सकते हैं. ठीक है. प्री प्रोसीजर सेम लाइक cardiac catheterization or PTCA, जो भी हमने intervention है, same interventions we are going to take here, same post procedure and same complications we are going to monitor the patient for. Okay. Common medications, same medications we are going to use, which is antiplatelet. After the procedure, IV fluid is important, anticoagulant is important, and pain management. Okay. Next is about atherectomy. So this is another tool that we can use, but it's the same procedure like cardiac catheterization. You are going to go in, but you are going to use a different kind of tools. And this tool, you can see here how it is going to remove this atherosclerotic plaque formation. Okay, so this is called atherectomy. Now there is only a few complications, like two complications are the main one. When you are removing this atherosclerotic plaque formation, what can happen? The small plaques can move forward, right? And if those are of big size, can get trapped somewhere and can cause emboli. So emboli is the biggest risk. Another risk, when you are trying to scrape this off, possibly blood vessels can get ruptured. तो परफोरेशन का भी रिस्क है यहाँ पे, परफोरेशन का रिस्क. एंड व्हेन यू आर जस्ट रिमूविंग दिस, देयर इज पॉसिबिलिटी के आफ्टर फ्यू मंथ अगेन इट कैन कम बैक. ओके, सो atherectomy is removal of the plaque from the coronary artery by using the cutting chamber or inserted catheter or the rotating blade. Okay, so there are different type of tools available that they can use to remove all these plaques and use to improve the blood flow to ischemic limbs in peripheral artery disease. Okay, complication with perforation and emboli is the biggest risk that you have to remember. Sometimes you may damage the arteries. Okay, next we do have is transmyocardial revascularization. Transmyocardial revascularization. First, I would like to show you the picture, then you can have a little bit better idea. So, transmyocardial revascularization. Transmyocardial revascularization, that means in the myocardial area, muscular area, you want to improve some circulation. And how you can improve the circulation? You are going to use this probe, and you are going to go in through this thoracic area. Okay, wherever there is a blocked artery, you are going to use this probe which has laser waves. Through that laser waves, you are going to create the small holes. Okay, small channels, you are going to open it up. This is a big view of it. So this is the probe. You are going to use that probe to create this kind of channels. The small holes will be created in the muscles area to improve the blood circulation. Okay, and when you do that, what happens is new blood vessels will grow. Our body has tendency to grow new blood vessels, which is going to give blood supply to that area. Okay, so new blood vessels will grow after this procedure. And let's say there is a necrosis area here, there is a necrosed area, so you are going to use this laser probe, you are going to create the small channels like holes, and then new blood vessels will grow, and that's going to improve the blood circulation to that particular muscles. Okay, so you are going to do the other procedure, but sometimes when there is a severe necrosis, you can also perform this procedure. So it's a surgical procedure where the laser channels are drilled directly into the heart muscles, and our goal is to promote the angiogenesis. What is angiogenesis? It's the formation of the new blood vessels. Formation of new blood vessels. Okay, access site performed by a thoracotomy. So I just showed you the picture. They will be going through the thoracic area, or during CABG itself they can perform this procedure. When they are performing surgery for the patient, CABG, cabbage, that time also they can perform this procedure. Now patient is not a candidate for the bypass, or it is often used when patient is not the candidate for cabbage. Okay, when the patient is not allowed due to any other reason, when patient is not able to undergo the surgery, तो ये procedure does help. Mechanism, तो जैसे मैंने बोला कि tiny channels you are going to create, and that's going to allow the new growth of the blood vessels to allow the perfusion to the particular area. Okay, now all of you use your favorite marker to underline cabbage. Very important procedure for your exam. Very important procedure. We are still talking about the coronary artery disease diagnostic procedure, and also we talked about some of the procedure which can be used for fixing the problem. Just we started with the cardiac catheter. First we started with the patient who came and who wanted to know about the blockage in the heart. So we did calcium score, okay, the scan. So with that scan, results were not that accurate. Okay, we sent the patient for CTA. So CT scan angiography. We injected dye. We took a picture of the blood vessels. तो उसमें भी क्या information मिलेगी? कोई narrowing of the artery है कि नहीं? उसकी information मिलेगी. If that is abnormal, I'm going to ask the patient to have some lifestyle modification for the prevention, because right now patient is not having any symptoms, so I cannot send the patient for cardiac catheterization, right? So lifestyle modification, cholesterol medication we can give to the patient. But if the patient has some discomfort while exertion, तो हम stress test कर सकते हैं. उसमें कोई problem आया तो definitely cardiac catheterization. Or for some of the patients when they come to the hospital with the chest pain already and EKG is abnormal, we definitely want to do cardiac catheterization. So through cardiac catheterization, you went in, you found out which artery is blocked, how much it is blocked. Based upon that, you decided to take some intervention. So उसमें आपने क्या किया? PTCA किया, which is plastic. You went in, inflated balloon, placed the stent, and then you came out. Now sometimes there are also other options other than stent placement. atherectomy. So you are going to pulverize all these atherosclerotic plaque to remove and to open up the way for the blood circulation. But वहाँ पे complications भी हैं थोड़े, तो वो हमने किया. We can use a laser light to break down all this plaque. वो भी हमने किया. Now sometimes patient came with a myocardial infarction and so many arteries are small, arteries are blocked. Okay, one is 80% blocked, one is 100% blocked, and patient is old. We don't know whether patient is going to survive or not. So many other factors that cardiologists consider. We are not cardiologists, but there are so many other factors that they will consider, and they will decide that these other interventions are not going to be helpful much, so they decide to go for scabbage, which is coronary artery bypass grafting. Okay, now here what is the main goal is, if any of the artery is blocked, okay, any of the artery is blocked in the coronary artery branches में, so what they want to do, they want to create the bypass. तो bypass में क्या है कि either they are going to use any of the vessels of the lower extremity, saphenous is the main one, saphenous vein which they can use, वहाँ से कट करके उसको लेके आएंगे and then they are going to connect. As of like, you know, when you are going somewhere and there is too much traffic, you are stuck, आगे जाने के लिए रास्ता नहीं है. So what are you going to do? Either you are going to go back or either you are going to take a U-turn. But back जाने के लिए भी रास्ता नहीं है. Why? Because it's a traffic jam. You cannot go back because there are so many vehicles behind you. So it's completely blocked area. Now if you do have some bypass कि साइड में से जाने की जगह है तो आप क्या करेंगे? You are not going to wait for long. You are going to use that route and you are going to take a bypass. So similarly, what we are doing is, if for blood circulation, if the way is blocked, आगे जाने के लिए रास्ता नहीं है, तो what we can do, we can create the bypass by using some other veins and arteries. जैसे mammary artery is used and saphenous vein from the lower extremity is most commonly used. तो हमने जो ब्लॉक है, रास्ता ब्लॉक है, उसको छोड़ दिया, and one end of the artery we connected here and the other end we connected here. So the blocked area is blocked, but the now blood circulation will start flowing through this graft. So that is CABG. We need to understand, we need to just have the information about the coronary artery branches, which is, this one is right coronary artery, this one is left coronary artery. Now here you can see which is circumflex artery, and this one is left anterior descending artery. Left anterior descending artery. Okay, so these are the branch. Any of the branch can get blocked. Okay, so yes, as I explained to you, saphenous vein you can use, or either internal mammary artery will be used. Okay, so bypass graft में you can see here, if this was blocked or this area was blocked, let's say, so you are connecting, you are using some other veins and you are bypassing the area, so the blood will be circulating through the graft. For you, what is important, you know, ICU will be taking care of the patient, patient will be connected with the ventilator, all those things are okay, but after this procedure, for you it's very important to monitor the patient for complication. उसमें होने के लिए क्या chances है कि this graft can get blocked. So you just perform the procedure, but sometimes if the patient blood pressure is very low, so possibly this graft can get blocked. Or sometime if the patient blood pressure is too high, बहुत ही ज़्यादा increased है, तो this graft can get rupture हो जाने के लिए chances है. So for both the complication you have to monitor, and for that blood pressure regulation is very important. If it is elevated, higher chance of rupture. If it is decreased, higher chance of getting blocked. तो वो एक हमारे लिए बहुत important है. After surgery we don't want any blockage, right? तो वो एक important है. Now this is a big surgery actually. So when patient comes to the emergency room, has a chest pain, and when we did EKG, we found out okay, patient is experiencing myocardial infarction, and they decided to perform surgery. But patient is once patient is out of the surgery, patient will be connected with the ventilator. So sometimes, so when patient is connected with the ventilator, there will be so many tubings that you have to take care of. There will be EKG monitor that you have to monitor. Sometimes to give the support, patient will have pacemaker connected from outside, so you have to monitor the pacemaker. So patient is in a bad situation. Patient is going to be in ICU. तो critical care हमको देना है. Ventilator आएगा इसमें, all the IV tubings आ जाएगा. Drainage के लिए you have to monitor. If an EKG monitor you have to check. If patient is in ICU, then you also can have support of the telemetry where they can monitor the EKG. But EKG monitoring is important. Pacemaker होगा तो उसको भी आपको check करना है. So many things. Now you have to take care of the scar. Like the one is a sternotomy they have performed. There is a sternotomy here. So there is a scar that you have to take care of. You have to watch for the infection. There is lower extremity scar where you have taken these syphilis ring. उसकी भी आपको care करनी है. There should not be any infection. How you are going to come to know whether there is infection? So you have to see whether there is any drainage coming out. There is a swelling. There is redness. Same thing in the lower extremity. So you have to monitor that as well. You have to check the labs frequently. You have to check the electrolytes frequently because these all things can change the electrolytes. So you have to monitor for the potassium level. You have to monitor the glucose. IV fluid. ज़्यादा fluid नहीं दे सकते, कम नहीं दे सकते. All these things. Now once the patient is stable after 24 to 48 hours, we can slowly disconnect the patient from ventilator. Now patient will be able to speak. But when patient is getting discharged, you have to give few instructions. Slowly the cardiac rehabilitation will start. कि heart अभी इतना weak है. You cannot just start running, right? Because heart we need to give rest to it. So slowly you are going to increase activity. तो cardiac rehabilitation में पहले patient was lying down all the time, right? Now slowly patient is going to sit up in the bed. बेड में बैठने के बाद if the patient is able to tolerate, we are going to ask the patient to stand. तो standing में patient is not having any chest discomfort, patient is not going to have any dizziness, तो we can ask the patient to walk few steps in the room itself. वो भी patient tolerate कर सकता है. Then slowly we ask the patient to go outside in a hallway and walk. तो this is called rehabilitation, cardiac rehabilitation, which is important. उसके लिए हम patient को बोलेंगे, explain करेंगे. And there is a most important education point that you are going to give to the patient, and you will see this question all the time. So patient is getting discharged, or maybe patient is coming for the follow-up after procedure. So patient is asking, when should I resume sexual activity? How nurse is going to respond? So there is only one fixed answer that you have to pick from your options. Okay, anytime if you are able to walk 2 blocks, or if you are able to take 2 flights of stairs without any short of breath, chest discomfort or any unusual symptoms, then you can resume your sexual activity. This is a fixed answer that you have to choose, that you are able to walk 2 blocks, or if you are able to take 2 flights of stairs, then you can resume your sexual activity. Okay, about the diet, you have to change the diet. Now patient is going to be on cardiac diet, DASH diet. DASH diet means what? Low fat, low sugar, low salt, and adding more vegetables and fruits. If the patient is smoking, तो smoking cessation education is important here. ठीक है, तो CABG के बाद all these things are important. Now again another important thing, as we discussed कि anklex में कोई भी surgical scar हो तो we can wash with water and soap, okay, but we don't allow the patient to take bath. तो similarly यहाँ पे भी education point है कि patient cannot take bath, but patient can take shower, and you have to keep the area dry. Okay, so this was the basic information. Now we are going to read together. So pre-operative care, what you are going to do? Informed consent, NPO. Patient is going to be NPO for 6 to 8 hours before surgery. We have to teach to the patient what to expect post-operative. So patient will have chest tube, patient will have ventilator, patient is going to be in ICU. Stop anticoagulant and antiplatelets as ordered before procedure, before surgery, because we don't want this patient to bleed. If patient is on any antiplatelet or anticoagulant, we have to stop. Baseline labs we want to perform. Okay, what is CBC, what is RBC, what is WBC, what is platelet. So after the surgery, the WBC counts are elevated. तो हमको पता चलेगा ना कि infection हुआ है patient को. We want to check the kidney function. Specifically, why? Because we talked about it, okay, when there is a problem in the heart, when the cardiac output decrease, kidneys are not able to work. The function is going to be impacted. So खास we want to check the renal function. So जिससे हमको post operative we can compare. Teach incentives spirometer, shave and prepare the area. Leg side where you are going to take out the graft, and also where you are going to perform sternotomy. So both the side is going to be prepared. पोस्ट ऑपरेटिव केयर में हम क्या करेंगे? सो यू हैव टू मॉनिटर ऑल द बेसिक थिंग्स लाइक हार्ट रेट, ब्लड प्रेशर, सेंट्रल venous pressure, cardiac output. Now central venous pressure, let me explain to you little bit here. Okay, this is the superior vena cava and inferior vena cava. Okay, now these are the central lines. Now here, if we are giving IV fluid to the patient, let's say, मैंने आपको क्या बोला कि soon after surgery we have to be very careful. We don't want to stress the heart. We want to give the rest to the heart, right? Now here, if we are giving IV fluid, because we also have to maintain the blood pressure. ब्लड प्रेशर ज़्यादा हो गया तो रप्चर के चांसेस है, ब्लड प्रेशर लो है तो ब्लॉक के चांसेस है. I am going to give the patient IV fluid, but I have to be very very cautious to give IV fluid. ज़्यादा नहीं हो जाना चाहिए. तो CVP, central venous pressure, will help me to decide whether patient is getting right amount of fluid or not. So they are going to insert the catheter somewhere here, and in this area, if this pressure in this artery is elevated, that means that too much blood is here or too much fluid is here in this area or too much fluid is passing through these vessels. So when we check the pressure of these blood vessels, the big blood vessels, if they are elevated, that means we need to decrease the fluid. Patient has overload. तो CVP चेक करके हमको बहुत इंफॉर्मेशन मिल सकती है. ठीक है. As a chest tube drainage, I already talked about. There would be chest tube, there would be IV lines, other drainage will be there, so you have to monitor the patient for. So chest tube, you are going to remember one thing, okay, if patient has more than 150 ml per hour, some of the book says 100 ml per hour, that's fine. Now you will get the big range. So if you are remembering 100 or if you are remembering 150, you are not going to face any problem. They will give you like 200 or 250 something, तो आपको कोई दिक्कत नहीं आएगी, which is really abnormal. ठीक है. तो 150 से ज़्यादा हो तो you are going to report to doctor. Okay. Tamponade, we are going to talk about that later. That is a complication that patient may develop after cabbage procedure. So hypotension होता है उसमें, muffled heart sound और jugular vein distension can occur. तो यहाँ पे please just remember this, but we'll discuss in detail. Okay. So cardiac tamponade is a complication where patient can have hypotension, patient can have jugular venous distension, and patient can have muffled heart sound. What is muffled heart sound? So when I auscultate the heart sound, I can listen to it very easily, okay? Or if you right now, if I'm speaking, you are able to listen to me clearly. But what if I'm speaking like this? Okay, so that is muffled sound. That is muffled. So this is how you are going to listen to the sound which is muffled in cardiac tamponade. Now ventilator support you have to give, and when you are going to wean the patient off, then you have to give वेंटिलेटर क्या है बराबर. न्यूमोनिया के लिए चेक करो, वो भी जो हमने रेसिपी में चेक किया, लर्न किया, दोज ऑल थिंग्स. Strict intake and output we want to monitor because we know that the patient is at high risk of acute kidney injury. So we want to check intake and output. Monitor the electrolytes, specifically potassium and magnesium. Potassium and magnesium we want to check because we know that hypokalemia or hyperkalemia, they both are related to cardiac dysrhythmia. Another important thing, once the patient has myocardial infarction, patient has undergone surgery, there is a higher risk of cardiac dysrhythmia. So after surgery, during the surgery, you are going to monitor the patient for the EKG, abnormal rhythm in EKG. You are going to perform EKG, continuous EKG will be there, and you are going to monitor for dysrhythmia. Okay. Pain control, definitely pain control, early ambulation, DVT prevention because patient is going to be lying down on the bed for a few days. So DVT prevention you are going to take. Outside, from outside, we are going to give some support to the heart. We are going to give pacemaker. Just in case if the patient natural pacemaker is not generating impulses to contract and to relax the ventricles and atria, then we are also having, we are also applying the pacemaker from outside that can give support for the heart rate. Okay. Daily shower is okay. Surgical incision are washed gently with mild soap and water. I want you to underline that. Pat it dry, but it should not be soaked or have lotion, cream applied. Not allowed. No lotion, no cream, nothing should be applied. And it should not be soaked, meaning bath is not allowed. Shower is okay. Bath is not allowed. Okay. So important intervention, daily shower, we already talked about. Explain the light housework may begin in 2 weeks, but you are not allowed to lift up anything heavy for more than 5 pounds until approved by doctor. Some of the doctor will say you are also not allowed to drive. So patient cannot drive for at least 1 month. Patient cannot drive, patient cannot lift up something heavy. So no driving, and light household work you can do, but not heavy lifting for more than 5 pounds. Okay. When you are able to walk 1 block or climb 2 flight of stairs, some of the book says 2 block, that's fine. So 1 to 2 block patient can walk without a symptom, or if patient is able to climb 2 flight of stairs, then they can resume sexual activity. Okay. If there is any redness, swelling on the incision side, then you have to take care of that too. WBC counts are elevated, तो infection का risk है, वो भी आप डॉक्टर को inform करेंगे. And there is a one weird thing that happens to the patient. Some of the patient may experience that after CABG, patient's cognitive function can get impaired. Patient can have memory loss. Patient is not able to focus on stuff. Patient will say, I feel like foggy. Okay, मुझे कुछ समझ में नहीं आ रहा है. I feel like I'm confused. I cannot think proper. So those all things is because of surgery. Okay, and it is going to get resolved in 1 month. So that is called cognitive dysfunction, operative cognitive dysfunction. Post-operative cognitive dysfunction is the name of that condition, where patient is going to have loss of memory, problem in focus, concentration. So this is possible. This is possible. Okay, clear hai yahan tak? And what medications are we going to give to the patient after surgery? So this is very important. Please understand, antiplatelet medication is important that you are going to give to the patient. Statins, because we don't want any other artery to get blocked, so statin is important. Beta blocker is the most important medication. कोई भी medication का आप medication list check कर लेना. Once patient has myocardial infarction, patient is going to be on beta blocker. पहले patient was not on beta blocker, but after myocardial infarction, this is the medication patient is going to be on. So beta blocker, statins for decreasing cholesterol, antiplatelet medication, pain medication, and this is very important, stool softener you are going to give to the patient. Why? Because if the patient has constipation, what will happen? Constipation की वजह से straining. When patient is straining, what can happen? Valsalva maneuver. That we don't want this patient to have, because we want to give rest to the heart, right? So stool softener आपको पहले से ही दे देना है, ठीक है? And then you are going to monitor for the complications, which are cardiac tamponade, bleeding, hemothorax, infection, atrial fibrillation, stroke होने के लिए भी chances है, acute kidney injury, graft occlude हो गया, वे सारे complications के लिए you are going to monitor the patient for. So this is a repetition, is a hint. You have to check the site for infection. You have to monitor the urine output for the kidney failure. You have to monitor the EKG for dysrhythmia. Okay, and teach the patient no heavy lifting and no driving and no sexual activity until whatever we talked about. Okay, so yes, so these are the procedures or diagnostic procedure we can say, or for the treatment, whatever procedure we perform, we talked about it. Okay, so let's revise. First we started with the cardiac markers. All of you, this is very important, we are revising all the topics. So let's focus. First we talked about cardiac markers. So in cardiac marker, why it is important? Because when patient has myocardial infarction or any muscle necrosis going on, specifically heart muscles, some protein are going to be released, and those are cardiac markers. They are going to stay in the blood for a long period of time, like troponin. So when we check the troponin, we can have idea if patient is experiencing myocardial infarction or not. Okay, there is CKMB, there is myoglobin, but those are not that effective. Then we talked about CBC, RBC count, WBC count, hematocrit, hemoglobin. So those are important if patient is anemic, heart has some stress. We talked about BMP, which was very important. कि when the ventriculars wall are stretching out, तो उसमें से रिलीज होता है BNP, तो हमको ये पता चलेगा कि patient has any heart failure, तो BNP will be elevated. तो BNP और cardiac marker को mix नहीं करना है, ठीक है? Then we talked about EKG. तो EKG में देयर वर डिफरेंट काइंड ऑफ EKG. पोर्टेबल EKG की हमने बात करी. हॉल्टर मॉनिटर, पेशेंट कैन नॉट टेक शावर विद द ट्रेडिशनल वन. Okay, 24 to 48 hour activity will be monitored, and then we can check whether patient was any abnormal rhythm, heart rate, conducting system में कोई issue है कि नहीं, तो वो हमको EKG से information मिलती है. Then I showed you the advanced one, like kind of patch that we have to apply on the chest, and that can monitor the heart activity for 7 days to 14 days. हम activity monitor कर सकते हैं. उसमें shower is okay. There is no, you don't have to worry about getting it wet. Okay, that we talked about. Then stress testing के लिए मैंने आपको explain किया कि stress testing हम कब check करेंगे, when there is a problem with the oxygen supply and demand. खास करके when patient is coming with a complaint of, when I'm lifting something heavy, my chest hurt, or sexual activity or any kind of exertion, physical exertion. So we perform stress test. Stress test when patient is performing, when patient develops any chest pain, dizziness, any discomfort, so we short of breath, we have to stop the test right there. And what we need to do, nitroglycerin दो, patient को ER में shift करो सीधा. Cardiac catheterization we are going to perform, because that's confirmed that somewhere patient has some blockage in the coronary artery. तो हम cardiac catheterization perform करेंगे. We did perform the pharmacological test where patient is not able to walk, so we can give dipyridamole. That's going to increase the heart rate, and we can get the information of EKG. Okay, so that's a pharmacological. Then we did myocardial perfusion scan. तो उसमें हमने क्या किया, radioactive isotopes दिया, and then we took a picture, scan किया. It's with very minimal radioactivity, so no harm to other people. That was the one. And then stress testing, we did echocardiogram. Echocardiogram के लिए हम याद रख सकते हैं anatomy and physiology. And ejection fraction, तो मतलब वो physiology में आ गया ना. So anatomy मतलब heart के valves, structures, chambers, everything you can get the information. And ejection fraction हमको echocardiogram से मिलेगा. ठीक है. Then we did cardiac catheterization. We did PTCA, plasty. We did atherectomy. उसके बाद we did laser angioplasty. So laser light से we vaporized all the cholesterol plaque. Atherectomy, laser angioplasty, एक laser ultrasound भी था, right? So ultrasound हमने किया, and then we created channels to improve the blood circulation or to allow these new blood vessels to grow, right? तो वो हमने एक procedure किया. And and CABG, which is the most important one that you have to remember. Please remember that whenever a patient has stent, you have to give antiplatelet medication. Okay, so we are done with all this diagnostic procedure. Please come prepared. And I'm going to upload the video right away, because even yesterday I just realized in the morning that I uploaded the video for the previous chapter, but the date I entered was, like old date, so you are not able to see that. But cardiac chapter I'm going to upload right now. So once you get fresh, relax, please watch the video and revise. Okay, I want you to be very perfect in cardiac chapter. Okay, so come prepared. I'm going to ask you question tomorrow. Okay, thank you, all of you.
Recording stopped.